नमस्तस्यै नमस्तस्यै नमो नमः या देवी सर्वभूतेषु क्षुधारूपेण संस्थिता नमस्तस्यै 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 नमो नमः या देवी सर्वभूतेषु छायारूपेण संस्थिता नमस्तस्यै 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 नमो नमः. Thank you.
Thank you, Sahana, for a beautiful beginning to our today's evening session. Now I would request our coordinator, Dr. Nikita Sharma, Assistant Professor, All India Institute of Ayurveda, New Delhi, to welcome the gathering. Over to you, ma'am.
Thank you, Isha. Respected Professor Yogesh Chandra Mishra, sir, Organizing Secretary of Vishwa Ayurveda Parishad, esteemed Professor Govind Shukla, sir, President of Vishwa Ayurveda Parishad, Honorable Professor Mahesh Priya, sir, General Secretary, Dr. Surendra Chaudhary, sir, National Secretary, and Professor Anu Shukla, sir, Rashtriya Pramukh Sambhasha, Prakost. Our today's esteemed guest speaker, Dr. KANNOLI, sir, from SVM Ayurveda Medical College. Our dedicated organizing team, Dr. Anand Katti, sir, Dr. Manoj Chaudhary, sir, Dr. Mohan Joshi, sir, and Dr. Devendra Singh Chahar, sir, Sri Nagesh, sir, who have also joined with us. Our others esteemed committee members of Vishwa Ayurveda Parishad, eminent scholars, and all the listeners who have joined from different regions of the country. I extend my warm welcome to each one of you to this distinguished gathering of Samhita Siddhanta Sambhasha. It is an absolute pleasure to have you all here for the discourse. So today we'll be having an insightful discussion on the clinical utility of Rasavimana. And we are truly privileged to have with us Dr. KANNOLI, sir, Associate Professor from SPM Ayurvedic Medical College, Ilkal, as our guest speaker. So his expertise on Samhita Siddhanta will surely provide valuable insights and fresh perspectives on today's topic. So once again, I welcome you all to this enriching session. Hope you all will find the session fruitful and meaningful.
Thank you, ma'am. Now I would request Dr. Sri Nagesh, sir, Professor and HOD of Department of Samhita Siddhanta, Sri College of Ayurveda and Research, Bangalore, to give the opening remark to the audience. Over to you, sir.
Sri Gurubhyo Namaha. Is it audible?
Yes, sir.
Yes, sir.
Yeah. Yeah. I thank Vishwa Ayurveda Parishad for giving me this opportunity for giving an opening remark on this online session about the clinical utility of Rasavimana by Dr. KANNOLI. I think the topic was taken was really uh, a valuable one, and it is very much essential for us because the description given in Vimanasthana are all given in the Sutrasthana in a minute form or else in a brief way it is explained, but in detail. Vishesha Gnana we need to have it regarding Dosha Beshaja Adi. For that purpose only Vimanasthana has been given. So in the Vimanasthana primarily, so the little extended part and a little more precise information regarding dosha, beshaja, adi. There are so many things are explained here. So among them, the most important one to begin with is the Rasavimana. He has made it as an important one in the beginning. And in this chapter, we get to learn so many important points here regarding the Rasadosha Sambandha also, and most importantly, here there is one point where he speaks about Vikriti Visham Samaveta and thus Prakriti Visham Samaveta we can understand. The Vikriti Visham Samaveta is linked with dosha as well as the vikaras, dosha and the dravyas. So here, multiple combination of the doshas, when they make it like samsarga or sannipata, when they are making it, we usually get a little confused that the symptoms which are produced in dvandva or sannipataja conditions, not all symptoms does tally with the dosha pradhanyata. If it is pitta and kaphaja vyadhi, then the pitta lakshanas and kapha lakshanas, what are all the symptoms or qualities mentioned under pitta and kapha, Not all those symptoms are seen in a disease. And in a given dravya, when all these rasas are present, different gunas are present, but their action doesn't tally with exactly what the quality as well as the rasa it has. Here comes the question, what actually happens to that combination of the dosha and vikara, and what happens to that karma of the dravya when they have these many rasa as well as gunas in it. So what we expect is, as per the dosha involved in a vikara and as per the guna and rasa involved in a dravya, it should be acting, but it doesn't happen. So why it is happening, so why such it doesn't tally with, so that we can understand with this concept, that vikriti visham samavita. So there are 3 points given here, that why it doesn't work together. नानात्मकानां परस्परेण उपहतानां अन्यश्च विकल्पनैः विकल्पितानां, these are the some of the reasons given. So they are the actually the areas where we can make research further, and we can understand why this the symptom produced doesn't exactly tally with the dosha involved, and why the karma doesn't exactly tally with the rasadi uh, rasapanchakas involved in the dravya. So these are the some very important concepts explained in this chapter, and they are explaining further about Trini Dravyani Natyapayanjita. So, and the effect of that overuse of these three dravyas. And another thing is Ahara Vidhi Visheshayatana, which is a very important aspect. Now it is where the so many companies are coming up and so many people are working towards the wellness. Actually, the well-being is a more precise one to be focused, not the wellness. So a person to be healthier and should be contributing for himself, his society, his family, he should be healthier. And what type of healthier practices he should have. So under that, ahara is the primary one. So in that, for hita and ahita, what are the reasons for it? So as a ahara, as a point, as a focus, if we take it as like with the hita, it is contributing or it is uh, counterproductive. So what are the reasons? So those reasons are enlisted in ahara vidhi visheshayatana. We need to seriously work on these each factor of these ahara vidhi visheshayatana, and we have to rectify, and we our duty is to convey that what is wrong, the things which are happening, and what are all the corrections to be made, because there are so many things coming up in social media as well as print media also, generally online medias also. There are so many health tips given. These health tips not always are really helpful. So people may believe, and sometimes it may be counterproductive also, like somebody is promoting the honey and they are promoting that it should be mixed with, instead of a sugar you can replace it with honey. They suggest everyone to add honey in everything, in every, like in tea also, hot tea also, in milk also, like that. Such things are also it is available in the online. But how much it is really helpful, as per principles of Ayurveda, it is counterproductive, which may cause serious health issues. So it's our duty to bring it to the society, the information that these are actually not really good. It is not just about what it contains in it, how it is in combination, how it is working on. Individually tea may not be harmful, individually honey may not be harmful. That's what samudaya prabhava, what it actually it does. It is individually it may not be doing any harm, but samudayatmak it may be doing some harm. So that is what we are going to learn in this first chapter. So these things are very important points, and this is really important for clinically also, where we usually see such cases of such improper following of this health, I mean food habits. So those are all the things we need to clarify using this information given in this chapter. And also ahara vidhi vidhana. Ahara vidhi vidhanam is while having consuming the ahara, what all the things we must follow. So in this busy schedule, we may have the like cold food. We are carrying food to our workplace, and we have it whenever the time is available. And when we travel, also whatever is available, we order and we do it. We have it. So not everything is going to be helpful for us. What are all the actually basic etiquettes we must follow, and what are all the healthier habits during food consumption? Those things are explained in Vidhi Vidhana. So I think this chapter is really a very suitable one. It was given to Dr. Arvind Kanoli, Dr. G.N. Kanoli, uh, and I think Dr. G.N. Kanoli is going to make justice with um, explaining about clinical utility of Rasavimana in this seminar. Thank you very much.
Thank you so much, Dr. Sri Nageshwar, for sharing your insights on the topic. Now, before beginning with our session, I would request all the audience to keep yourself muted, please, for the smooth conduction of the session. You can drop your queries in the chat box, or after the session, you can unmute yourself and ask your queries. Now, I welcome Dr. G.N. Kannoli, Associate Professor, Department of Samhita Siddhanta, SVM Ayurvedic Medical College, Ilkal, Karnataka, to address the gathering and begin the session. Over to you, sir.
Thank you, madam. Is it visible, madam?
Yes, yes, sir.
Yes, sir.
Shall I start, sir?
Yes, sir.
Namaste to everyone. आपादमौलिपर्यन्तं गुरूणामाकृतिं स्मरेत् तेन विज्ञापनश्यन्ति सिद्ध्यन्ति च मनोरथानि. Myself, Dr. G.N. Kannoli, Associate Professor in the PG Department of the Ayurveda Samhita Siddhanta in SVM Medical College, Ilkal, Karnataka. I thank for the Vishwa Ayurveda Parishad for giving in a chance and opportunity for me to share my view of the Rasavimani Adhyaya of the Charaka Samhita with its clinical utility. As by today, I will enter the topic with some contents like introductions, aim and objective, Rasavimani Adhyaya in detail with its clinical utility. Last, I will make a small conclusion about the today's my topic with my view. As it's a content chapter itself is the Vimana Artha, Rasa Trive Dosha Rogaha Prabhavataha, and the Dravyani Nati Sevyani Trivida Dravyani Nati Sevyani, and the Satvem Aharayatani Astau Aharayatani, at last Bhoja Sadgunya, that is a Bhojana Vidhi Vidhana, the told it. Today's my aim and objective for this one Rasavimani Adhyaya is a clinical utility. How it will be comes from after the reading and after the understanding this one chapter. And especially when we are turning towards the chikitsa of any of the diseases, a clinical utility in the chikitsa for any of the diseases. It will make us to make a good excels and a good improvement while treating the patients. That makes the a good exercise for the even vision for the while doing the chikitsa to the patients. As the first chapter itself is started, a few of the points I want to highlight as per the view of the ancient authors and the commentators, like in Charakopaskara Yogindrinath Sen, he mentioned that Rogo Ado Pariksheta Tadanantaram Aushadam Iti Ado Roga Jnanam Paschat Chikitsa. Before moving towards the Roga Chikitsa, we should analyze the Roga Pariksha, Roga understanding. Then you have to move for the Aushadha Chikitsa for the particular diseases. So for that understanding only, the Vimana has started one. That's why it holds the Vimana Rasadina Visheshamanam. So Rasadinam, etc. things are present. Visheshamana will be explained one. Even the Gangadhar also had mentioned a Visheshena Yatha Yukata Miyate Anena Iti Vimanam. What you mean by the Vimana is nothing but it's Visheshena Yatha Yukata. As per my convenient, as per my view, as per my buddhi, how much of I can excel the things of understanding about the Visheshena Yatha Yukta Niyate Anena Mana. How much I can enable to understand about the Vimana Sthanana, Athva the things which are present related to the understanding of the diseases when you are moving towards the Chikitsa. That mana they are explaining it. That is an important thing highlighted by the Gangadhara in his Jalpakalpataru Vakyam. So especially in this one chapter, they told it's a Vimanartha like Nimitta Pururupa Rupa Pachaya Sankhya Pradhanya Vidhi Vikalpa Balakala Vishesha Anupravishananta. These are the Visheshata to be understood before going to Chikitsa. Anyhow, Nidana Panchaka, we know that one Nimitta Pururupa Rupa Pachaya. But remaining things, Sankhya, Pradhanya, Vidhi, Vikalpa, Balakala, they are nothing but the bhedas of the Sampraptis only. That is a Nidana, Pururupa, Rupa, Upashi, Samprapti. These are the Samprapti bhedas only. After the understanding of the Nidana Panchaka, especially for the Bishak, when he entering into the Chikitsana, before understanding the diseases, he should make the Vishesha Anupravishanantara. After the understanding Nidana Panchaka, that is a diagnostic only. After the diagnostic of the, as per the Ayurvedic Nidana Panchaka, then even though he is need some other extra skills like dosha, beshaja, desha, kala, bala, sharira, sara, ahara, satmya, sattva, prakriti, vayasam, vishesha, anupravishanantara, even these are also needed for the bishop to understand this. As a mana avahita manasa yathadneyam bhavati. When the bishaja, when bishop become like a manam avahita manasa yathadneyam bhavati. In his mind, how he is understanding about the mana of these things, like a dosha, kala, all those one, and nidana panchakas also. If it is as it is, means yathavat neyam bhavati, then only he can able to doshadi mana jnanaya tattvat kriyayaha. He can able to do the chikitsa after the doshadi mana jnana only. Not only the even importance for the nidana panchaka, even he is also an equal importance for the doshadi mana jnana also. Like in the previous we told, dosha, beshaja, desha, kala, bala, sharira, sara, ahara, sat. These are also needed equally. As per my view, it's an equally, but here the author is telling it that even the commentators, they told it's a doshadimana jnanaya tattvat kriyayaha. That means when the person is able to understand the Nidana Panchaka, means he is able to capable to understand the doshadi jnana. That tattva is needed one. When he proceeding for the kriyayaha. Na hi amanatnya doshadina bishak. Then when the person or when the bishak he is unable to have the jnana of the doshadina, that is doshadimana, definitely vyadi nigraha asamatto bhavat. He is unable to do the vyadi nigraha. Either maybe it's in a shamana or maybe it's in a completely mitigating of the diseases also. He is unable to do the vyadi nigraha. Unable to control the vyadi also. Not the understanding. Here they're telling it's when you're doing the chikitsa means the chikitsa won't become so successful. So that is vyadi nigraha samartho bhavati. That means when the bishop is able to know, that is manatnyo, doshadina manatnyo. The bishop doshadina manatnyo, definitely he can able to do the vyadi nigraha samartho bhavati. So that's why they told it's a tasma doshadimana jnanartham Vimanasthanam Upadekshyamu Aktiveshika. That's why the Aktivesha started this one with the debating with the gurus only. So this is actually the highlighting point from the Rasavimana Adhyaya. As the doctor is not enough to get understanding of the Nidana Panchaka, even he is able to understand the Doshadimana, then only he will be able to capable to treat the diseases. That is the for the good exercise for the doctors. When Vyadi Vinishchaya is happened, after the understanding the Nidana Panchaka, even Dosha, Dimana, etc., Vyadi Pratyanika Chikitsa able to do by the doctors. So that's this is a needed one. Not only the Vyadi Vinishchaya, even he can able to do the Vyadi Pratyanika Chikitsa also needed one. So Nidana Panchaka only meant for the Vyadi Vinishchaya, even the Dosha, Dimana, etc., they mentioned for the Vyadi Pratyanika Chikitsa. When doctor is proceeding for the Vyadi Chikitsa, then he is able to do the Vyadi Chikitsa only when he is able to understand the doshadipana. So then only he will call as a bishop. So as the Charaka has a speciality to start each of the chapter with the first word itself, the Rasa, Dravya, Dosha, Roga, etc. started. That's why it's a Rasavimana Adhyaya. As like in the Dhirgam Jiviti Adhyaya said, he started with the Dhirgam Jiviti Adhyaya. That. Tatra Ado Rasa, Dravya, Dosha, Vikara, Prabhava and Vakshamaha. Starting only he will start the Rasa, Dravya, Dosha, Vikara, Prabhava. So from this one word only he took the Rasavimana Adhyaya. Rasaha tavat shat. As we know, the rasas are only the madhura, amla, lavana, katu, tikta, kashayah. Te samyak upayuchyamanaha shariram yapayanti. Mithyopaयुज्यमानाः tu खलु dosha prakopa prakopaya upakalpante. Like normally we know that the Vyadhi Nigraha Samartha Bhavati, when doctors become the Vyadhi Nigraha ability, after the understanding the Doshadimana, etc., Doshadimana along with the Nidana Panchika Arthas. The next level author is want, the Charaka want, and even the Ayurveda also makes the each of the doctors should be understand this concept like a Rasa Dravya Dosha Roga Prabhavata. That is essential. That is a simple word. Rasa Prabhava, Dravya Prabhava, Dosha Prabhava, Vikara Prabhava. So that's why author is started the Prabhava and Vakshamaha. Rasa Prabhava is nothing but the Vishesha Karma which is done by the Rasa, the Vishesha Karma done by the Dravya, and similarly Dosha and Vikaras also. This is a Prabhava and Vakshamaha of the Rasa, Dravya, Dosha and Vikara. How it is? The first one is the Rasa Prabhavata. The Rasa Prabhava is nothing but Rasaha Tava Shat. As we know, the Madhura, Amla, Lavana, Katu, Tikta, Kashayaha, Te Rasaha. These are the 6 rasas will be there. The Shat Rasa. Samyak Upayuchyamanaha Shariram Yapayanti. When these Shat Rasas are Upayoga Yukta, Samyakkena, then Shariram Yapayanti, Sharira Palayanti. Even the Anupalayanti. Sharira will get maintained as per our equipment, like maybe in the Balavastha, Madhyamavastha, even the Ruddhavastha also, in the Rogyavastha also. Especially we are talking about the in Swasthyavastha. Shariram Yapayanti, Swastha Rupena. Samyak Upayujyamanaha. Only when it is used into properly, then only it will be make the Sharira Pala. Otherwise, opposite to this one are in other than the Samyak Upayujyamana, Mithya Upayujyamanaha. Not the Ati or Hina, but here they told it's a Mithya Upayujyamana. It considered Mithya means it's Atihi or even the Hina also. Especially here it's a Mithya is improper for the Sharira Palanartha. In that way, if you used it, all the Shad Rasas, then definitely Mithyopaयुज्यमानाः tu khalu nischayena dosha prakopaya upakalpante. So definitely make the dosha prakopa of the sharira. One such a thing has to be observed. Mithya upachara either should consider mithya only or hina or ati. It will come to the all the 3, the mithya, hina and ati also. Ayoga sometimes it will be considered, but sometimes it's not be able to consider as per the consideration of the dosha prakopa. If it is making dosha prakopa, then it will be included in the mithya upayujyamanaha. The next one is after the understanding the rasa prabhava. Next is the dosha prabhava. Doshaha punaha triyo. As we know, the vata pitta shleshmanaha triyo doshaha in the sharira. Te doshaha prakriti bhutaha shariropakaraka bhavanti. When they are in the prakriti bhutaha, definitely the sharira upakaraka bhavanti. For the sharira, they are the upakaraka. Otherwise, when the vikruti apannaha due to the other factors like previously it's mithya upayujyamanaha, shat rasaha, definitely make the sharira na palayanti. Vikruti apannatha. Then tu khalu nischayena khalu nanavidaihi vikaraihi shariram upatapayanti. See, here definitely not he told about the vikaras are produced. He told about the nanavidaihi vikaraihi shariram upatapayanti. Tapa is just a difference between the upatapayanti, tapayanti is a tapa means just it's a heat. Upatapayanti means it's making the near to that one sharira completely involving in the vyadhi, then he making the sufferer. That is called as upatapayanti. Vikruti apannaha, when the diseases are occurs, apannaha occurs in the sharira, definitely nana vidai vikara sharira upatapayanti. They will make the not only because of the one rasa or one vikruti, one rasa sevana, mithya rasa sevana leads to the dosha prakopa, leads to the vikruti apanna in the sharira. Not only one disease is producing, nana vidaihi vikaraihi. Whenever we have a jara, it's having along with so many other subordinated lakshanas will be there. Vikaraihi, they told it. Nana vidaihi vikaraihi sharira upatapayate. This is dosha prabhava. One dosha prabhava, prakriti bhutaha, when the doshas are in the prakriti bhutaha, the prabhava is sharira upakaraka bhavanti. Another one is the Vikrutim Apannaha means, so when doshas are in the Vikruti Avastha, definitely Nadamida iti Vikara Uppatapayanti, that Prabhava occurs in the Sharir itself. When the combination of the rasa dosha prabhava and the rasa dosha involvement, like Maduramla Lavana, Katutikta Kashayas are there, both are having the interconnected with the rasa and dosha. Tatra dosham ekaikam, like Vata Pitta Kapha, these are the Sharirika dosha. And trayaha trayo rasaha janayanti dosha. The starting first rasas will be there, or maybe in each of the doshas have the capacity to produce it, doshan prakopayanti or janayanti. Here the author is told to janayanti, doshan janayanti, 3 rasa. And the 3 rasas will make the doshan prashamayanti also. So trayaha trayo rasa janayanti doshan. So vatam janayanti, pittam janayanti, kapham janayanti. In this way, author is told the rasa dosha prabhava, how it occurs in the sharira. When we are consuming the ahara, its ahara is a rasa pradhana ahara only. Always ahara is a rasa yukta. Trayaha trayascha upashamayanti dosha. So similarly, vata will get upashamana, pitta will get upashamana, kapha will be upashamana by the three rasas separately. Like rasaha janayanti doshan, rasaha upashamayanti doshan. Like katutikta kashaya vatam janayanti, maduramla lavanaha tu enam shamayanti vata zone. Like katutikta kashaya vatam janayanti means it's when the vikruti apannaha shariram. Doshas when comes with the vikruti apanna because of the mithya upasevana of the rasazon, the katutikta kashaya. Similarly, when the samyavastha is there and samyak rasa sevanas occurs, like a madhuramla lavana ena vatam shamayanti, that is samyavastha. And similarly, katu amla lavanam lavanaha pittam janayanti, pitta dosha will get janayanti. Here janayanti means samanyena janayanti, not the vikruti utpatti. When it is ati sevana occurs, then it's a vikruti. For the sharira, for the sustaining purpose, we need the pitta, vata and shleshma also regularly. These are the main rasa to produce the some particular respective vata, pitta, shleshma doshas in the sharira. If it is ati yoga occurs, janayanti will be making the more productions in the shariras also. Either it leads to the crossing the limitations of the normalcy, then it leads to the utpatti towards the prakopa avastha also. Madhuratikta kashayastu ena pittam shamayanti. Similarly, madhuramla lavanaha shleshmanam janayanti. Katutikta kashayastu ena shamayanti shleshmanam. Observation of the one thing is there here. Generally, we studied this one as a general one. The speciality of the things which are occurs in the rasa dosha prabhava as per the Charaka Vimana, like few of the points which are highlighted by the Yongi Trinatha when he making the comment on the Charaka Samhita, Charakopaskara, the Panchamahabhuta combinations which are present in the Vayu, Pitta and Kapha, they will make the Prakopa Ara, maybe the Shamana, when your consumption of the rasas will be there, based on the Panchamahabhuta combinations only. Just observing that when Vayu Kakasha is there, because of the Vayu will produce the dosha. Similarly, when the Vata dosha makes the substitution because of the Madhura Amla Lavana is there, this is the opposite way. Like in the Panchamabhuta combination, the Katutikta Kashayas are there, I highlighted with the light blue color, that one, sky color. This is the Anila, Anala in the Katu. Tikta Rasa will have a Vayu and Akasha. Kashaya Rasa will have a Vayu and a Prithvi, Mahabhuta. The each rasa, when you are observed these particular rasa, they have contained the anila as in the combinations of the Panchamahabhuta. When the Vata dosha itself is having the Vayu and Akasha dosha, definitely they will make the aggravations. That is the Utpatti Karka. And they will make the substitution simultaneously, the Madhura Amla Lavana, sequentially. How the Katutikta Kashayas are make the Vata Utpatti in the Sharira, Dosham Prakopayanti, Dosham Janayanti. Similarly, the Madhura Amla Lavana, Dosham Upashamayanti, because the opposite qualities are there. Or in simple, instead of using the word opposite, it not containing the Vayu and Akasha Tattva in these combinations of the Madhura Amla Lavana Rasa. So that's why its own produces the Vayu Utpatti. Instead of Utpatti or Prakopa, it will make the Anutpatti of the Vayu are upashamayanti of the Vayu. Similarly, Agneya Tattva is present in the Pitta dosha, Panchamabhuta combination. Definitely, wherever the Tejas or Agni Mahabhuta dominance is there, definitely they will produce the Pitta. And even they are extended for the Prakopa of the Pittas also. Like Amla, Lavana, Katu, Rasas are having the containing of the Tej Mahabhuta. So that's why definitely those rasas will make the utpatti of the pitta doshas in a sharira. Similarly, the kapha the doshas are there. It's containing the ambu and prithvi mahabhuta. Similarly, wherever the prithvi and ambu mahabhutas are contained is there in the rasa, they are producing like a madura amla lavana. They produces this. Wherever the one question is there, where the kashaya rasa is there, it's contained the prithvi. It contains the prithvi. Even though it's not producing the kapha, it will reduce the kapha. Like a katutikta kashaya always reduces the kapha dosha. But prithvi mahabhuta is there in the kashaya rasa. How it will be coming to the shamana karma for the kapha dosha when we are consuming the rasa? That point will be highlighted because of the gunas which are present in the that kashaya rasa. We'll discuss in the later next slides. When we are considering the rasa dosha prabhavana, this usually comes with the rasa dosha sannipate to e rasa e doshaihi samana gunaha samana guna bhuishtaha va bhavanti te tan abhivartayanti. They're telling here it is samana guna yukta rasas, samana guna bhuishta rasa, samana guna yukta doshas will get the abhivartayanti. In the rasas, whichever the gunas are there, so as it arises one questions in here now, the Kashaya Rasa, as it contains the Vayu Prithvi Tattva as a Panchamahabhuta, even in the dosha also the Kapha is having the Ambu and Prithvi Tattva. Na? As the same combination is there, na, Prithvi, definitely it should increase as the Kapha dosha. Instead of increasing or instead of Utpatti, Janayanti, it will make the Upashamayanti. So there is a questions will comes. Na? So for that one, there is a clarification is there. Rasa dosh sannipate to ye rasa yei doshaihi samana guna. Now they're talking about the gunas only. Because of what the guna present in that kashaya rasa, because of that one, it is increasing one. And one more is that the dominantly in the kashaya rasa, vayu is pradhana is there, comparing to the prithvi. So that's why vayu is always makes the kapha shamaka zone. This is also second point which is makes the validity for the kashaya rasas will always make the kapha shamana. So when the samana guna presents in the dosha, samana guna bhuishta rasas will always make the abhivardhana of the doshas only. And similarly, viparita guna bhuishta always makes the shamana of the same doshas. When the viparita guna presents in the doshas, whichever the gunas are there, opposite to that, viparita guna yukta of the doshas presents guna bhuishta in the rasas definitely makes the shamana of the respective doshas only. Etad vyavastha hetoho षटत्वं उपदिश्यन्ते रसाना परस्परेण असंतुष्टाना त्रित्वं च दोषाना. So this is in a combination. Rasa dosha prabhava, why it is essential? Because of the ahara consumption is essential for each of the organisms, especially in the manava, in the patients, even the swastha also. Whenever they are consuming the ahara, they are containing the shat rasa yukta aharas only. In those shat rasa yukta ahara, whichever gunas are present, either they will samana guna bhuishta or viparita guna bhuishta, whichever the dominated are there in the ahara, like a samana guna bhuishta is means respect to those doshas will get the abhivartana. Whichever viparita guna bhuishta in the aharas are there, definitely that will makes the dosham shamayanti in the shariras. Yeah, one more good highlighted by the Sri Gangadhara, the Acharya, in his Jalpakalpataru. He used that one because of the doshas, not only Utpatti or Shamana because of the rasas, even its containing of the Panchamahabhuta, extending to the gunas which are present in those respective rasas will makes the dosha Shamana, dosha Utpatti or Janana also. Like one of the example, Madhura Rasa, it contains the Prithvi and Somagunayukta. Prithvi and Somagunayukta, even it's also have the opposite quality, are not containing the Prithvi Soma in the Vayu Utpatti of the Panchamahabhuta. Vayu Akasha makes the production of Vayu, but its gunas are there, Snigdha, Guru, Shaitya. These are very important one. Why the Madhuras makes the Vata Shamaka. Amla makes the Vata Shamaka. Lavana makes the Vata Shamaka. Which one is the best to reduce the Vata, like a Vata Shamaka among the three rasa? It's depending on the gunas which are present, contained in them while formulating the from the Pancha Mahabhuta. Because Snigdha Guru Shitata is there in the Madhura, Lagu Ushna, Snigdha gunas are present in the Amla, Guru Snigdha Ushnas are present in the Lavana rasa. So these are the special things which are made by the Gangadhara in his Jalpakalpa Taru. As I left na Kashaya Rasa, even though it's containing the Prithvi Mahabhuta, even though it's not making the Kapha Utpatti or Kapha Janana in the Sharira, instead of that one, it's making the Kapha Shamaka, Kapha Upashamayanti, because it's Gunas only. Ruksha, Shita, Guru is there. Even those two Gunas, Shita and Gurus are there, even those Gunas are also, comparing to the Ruksha, they are less dominated. Rukshata is a Pradhanatva is a Pradhanena Rukshata is a, hence it's making the Kapha Shamaka. When comparing it to the Kapha Panchamahabhuta Sanyoga, it's based on the Guna and the Panchamahabhuta. This is one of the highlighting point from the Gangadhara. Why we need the Rasa Dosha Prabhava understanding? Samsarga Vikalpa Vistaro Hi Esham Aparisankheyo Bhavanti Vikalpa Bhedat Parisankheyatvat. So when we are making the Rasa and Dosha Sanyogana, Samsarga Vikalpa, they are making a number of the formulations will occur. When you make the Samsarga, only with the Rasas, only with the Doshas, if you are make the Parisankheya, countable forms of the formulated will occur. But this on this one base only, the doctor himself, the bishop only has to get understanding whichever the combination of the ahara is there, whichever the rasa dominance is there in the consumable form of the ahara. Like maybe you can take the odana. In odana, it's maybe na dauta, shruta, etc. Processed odana will be there, cooked rice. Because of the samsarga and vikalpana, it's make the good qualities also, some added qualities will be there, or some of the deleted qualities will be there. Depending on that one, either the rasa or dosha will make the shamana or janayanti in the shariras also. That's how it makes the Vishak has to make the concentrate towards the rasa and dosha when he observing the patients with the nidana panchaka and doshas also. Tatra khalu aneka raseshu. Now it's in a dravya and vikara prabhava. So one is the rasa, one is the dosha. Now the author is extending the same concept for the dravya and vikara prabhava. So as the aneka raseshu, so many rasas are there. We have the shat rasa. Those shat rasas, again it's in a different formulated will be there in the each of the dravyas. Like a dravyeshu aneka raseshu. Aneka raseshu dravyeshu. Madhuratva is there, the Madhura rasa is there. Same the Madhura rasa presents in the sugar or sugar cane juice and the jaggery. It's a different. Even the Kshirat is also Madhura, but it is also having a different variety of the Madhura rasas only. Madhura Tara, Tama, etc. will be there. Aneka doshatmakeshu. Aneka doshatmakeshu. Other maybe in the Utpatti of the Vikaras also, or in the Sharira dosha itself also. What the Vata dosha I have in my Sharira, it's maybe comparing to the other person's Vata dosha is maybe less or more. But the qualities present in my Sharira Vata dosha is different. That's why he used the Aneka doshatmakeshu. Even when we are observing the disease also, the Vikara with the persons also, there also Jara is maybe in the same. Even he is also have the Jara, me is also have the Jara. What the Jara doshatmaka lakshana is there, that is different. Atma lakshana is Santapa. But Santapa in their Santapa only is again the difference is Taratama Bhava Pulpita. That's why he used the Aneka Doshatmakeshu. Vikareshu. Again in the Vikara, Aneka Doshatmakeshu is there, Aneka Dravyeshu is there, Aneka Raseshu is there. Rasha Dosha Prabhavam Ekaikasena Abhisamiksha Tato Dravya Vikarayoho Prabhava Tattvam Vyavaseta. So when we are able to understand the Rasa Prabhava and Dosha Prabhava and even combinations of the Rasa and Dosha Prabhavana, we can able to Ekaikasena Abhisamiksha. We have to observe each of the Rasa, each of the Doshas, which Rasa is making the provoking or the Shabana or Janayanti in the Sharira, particularly which Dosha. After that Abhisamiksha, Tatho, similarly, Dravya Vikarayoho Prabhava Tattva Vyavaseta. Again, you have to make the same understanding and the same formulations of the understanding of the Rasa Dosha Prabhavana in the Dravya and Vikarayoho. So this itself is called as a Prakriti Samasvapeta. The particular dosha, particular rasas will be making the janayanti, particular rasa will make the particular doshas upashamayanti. As it is understanding the combination of the Panchamahabhutas and the respective gunas containing the rasas and even the doshas also. That is understanding is called as a Prakriti Samasamaveta. Sama guna, sama Panchamahabhuta, sama dosha yukta, they will make the janayanti. Vishamata is there means they will make the shamana. Extend with the prabhava once again. Na tu evam khalu sarvatra. What we have understand the rasa, dosha, and the dravya and vikara, all the time it's not the same. Na tu evam khalu sarvatra. In all the conditions, all the way. All the situations of the sharira, swasthavastha. When in all the times also, it's not the same. Na hi vikriti vishasamavetanam nanatmakanam parasparena cha upahatanam annescha vikalpanaihi vikalpitanam avayava prabhava anumanena eva samudhaya prabhava. So this is the because of the samudhaya prabhava tattvam adhyavasatum shakyam. Sometimes what the prakriti samasamaveta is rasa, dosha, dravya, vikara, it's not whole statements, so definitely there is a samudhaya prabhava will be there. So one more point is want to highlight in the rasa, dravya, dosha, roga prabhava. Apart from this one, the combinations. Separate rasa prabhava, dravya prabhava, dosha prabhava, we know that, and similarly the vikara prabhava also. When the together, maybe in a rasa, dravya, the rasa, dosha, dravya, and the vikara, when they're combined, some other formulations happened. Because of that one, some effect will come. That is called a samudaya prabhava. That itself is called as vikriti vishama samaveta. Yeah. Vikalpanaihi vikalpitanam, what they told na, vikalpanaihi. When we made the vikalpana means combinations, permutations, etc. They comes under vikalpana. Vikalpita, when those formulations, combinations occurs now, some different parts will occur in there. Like Madhura Rasa is there. For the Madhura, Shira Madhuratva is now used. When I used this Shira Madhuratva, because of the Alpa Kshira Sevana, Alpa Dosha or maybe an Alpa Kapha Utpatti occurs in the Sharira also sometime. Avayava Prabha, what they told na, some particular part of the Sharira only, it will make the Kapha Utpatti in the Sharira also. Or sometime because the combinations of all the things like what I consume the Kshira Madhura and even the dosha which presents in that kala and where the Sharira Avayava or maybe in the part of the Dravas also, all together makes the Prabha Utpatti in the Sharira. Sometimes it's unable to make the Rasa, Dosha, Dravya and even the Rogas also. That time definitely it is a Anumana Gamya Jnana of the effect. Anumana Gamya the Prabhavas only. That it's called as a Vikriti Vishnu Samavetana. That's what the author is used, the Samudhaya Prabhava Tattvam Adhyavasatum Shakyam. Definitely, the bishop should make the understanding of the things from the Samudaya Prabhavas only. Next, how can you use this one? Rasa Prabhava, Dravya Prabhava, Dosha Prabhava, and Roga Prabhava in the Chikitsa. As we are when treating the patients or observing the patients, this is essential. As we know the rasa, as we know the rasas are the katu rasa makes the daha. An example, it's produce the daha in the sharira. Either produce the sarvanga sharira or maybe in the mukha bhaga or in the urdhu bhaga also, or in the udara bhaga also. Madhura rasa makes the shamana of that katu rasa janya daha. What extent is there in a katu rasa janya daha? Either maybe it's equal to the madhura rasa shamana or sometimes it's need more that also. Similarly, dosha pratishaya is there. Na? Example taking the pratishaya produces the because of the vata and kapha yukta. Either maybe it's a get the upashamana because of the pitta. As the agni vartana is occurs, na, it makes the vata shamaka also, kapha shamaka also because it contains the agneya pradhanatva is there. As agneya is not present in the kapha dosha and vata doshas also as panchamabhuta combinations. And when considering the dravya prabhavana, as the gritha vyapat when it occurs at the conditions while taking the snehapana, the takra has become a good shamanopaya for the Grita Vyapat conditions with help of the Dravyas. When it comes the Vikarana, in the Pakshagata especially, Virechana is in a Shamana, or maybe sometimes it's in a Pratimargahara Chikitsa also, or Pratidunda Chikitsa also makes a good effect in the Vikara Shamana of the Pakshagata. This may comes under the Prabhava which comes in the Vikara, Dravya, Dosha, Rasa, how we are using in the Chikitsas also. So when they're treating the patients, the bishop should observe the Rasa, Dosha, Dravya, Vikara, basically. Even it's make the more effect of over the Chikitsa for the disease also. तथा युक्ते ही समुदाये समुदाय प्रभाव तत्वम एव उपलभ्य ततो द्रव्य विकार प्रभाव तत्वम व्यवस्थित. And when we are understanding the rasa and dosha, similarly it is also present in the dravya vikar prabhav. So the same thing will be observed in the dravya prabhav also, and even the vikar prabhav also. Rasa as a rasa prabhava is there, dravya prabhava is also there, and dosha prabhava is also there, and vikara prabhava is also there. Understanding all the four, in samudaya also, and separately also, all together makes the good effect in the understanding of the Nidana Panchaka of the doshas also, rogas also, even the while doing the chikitsa also, these will make the helpful for the bishak also, while it's making the upashamana of that particular vyati. Tatra esha rasa prabhava upadishto bhavati. As a rasa prabhava is also there, dravya prabhava is also there, and even the dosha prabhava and vikar prabhava. Dravya prabhava is also explaining now. When previously we have understood the rasa prabhava and dosha prabhava. Extending to that one, again the author is want to explain the dravya prabhava, how it comes. Before to understand this one, he explained the samudaya prabhava as itself is in a vikriti vishama samupeta. If it is occurs as according to the rasa, dosha, and the dravya and vikara, then it's called as prakriti samapeta. Taking a small example, author himself took in a dravya prabhava with explanation of the taila sarpin madhuni, and these are the famous parama aushada for the vata pitta shleshma prashamanarthani dravyani bhavante. For getting in a meaningful understanding of the prabhava, in the Gangadhara in his Jalpakalpataru, he told it's yad dravyam yat karma kartum yatha prabhavati tat karma karatvena tasya prabhatvam prabhavaha tam. The dravya in which way it going for making the prabhavati for the do the karma, that itself is called as a prabhava. That means dravya itself has a capacity. Dravya itself has a capacity towards to do the prabhavati for a particular karma. That karma either it may be because of its rasa, maybe it's presence in that particular dravya, or maybe in a guna which are present in there, or maybe in a vikara which are present in there. Whatever it may be, its samudaya prabhava occurs from that particular dravya itself. That's why it told it's going for the prabhavati. The kartum prabhavati. That kartum prabhavati, it has capacity. Karma karatvena, in which way it's going to make that particular karma. Karma karatvena, kartrum prabhavati, that prabhutva is there in that particular dravya, that is called the prabhava which is present in that particular dravya itself. Taking a small example like a taila. Understanding that rasa, dravya, dosha, roga, prabhava, with taking a small example like a taila. I took this example from directly in the textbooks only. तत्र तैल स्नेह औष्ण्य गौरव उपपन्नत्वात् पातं जयति तत् तत् अभ्यस्यमानं वातो हि रौक्ष शैत्य लाघव उत्पन्नो विरुद्धगुणो भवति विरुद्धगुण सन्निपाते हि भूयसा अल्प अवचीयते तस्मात् तैलं वातं जयति सततं अभ्यस्यमानम्. It's involved all things in the taila with the example of the taila. Like a taila contains a sneha ushna guna, that is aushnya, guru gaurava guna, upapannatvad vatam jayate. When we took the taila, taila is having the snigdha guna. When it used in the sharira, either in the bahya upakrama or in the abhyantara upayojana, it's make the snigdhata in the sharira, aushnata in the sharira, gauravata in the sharira. That itself is called the utpanna vatam jayati. in the Sharira, because of the Rasa Sevana, because of the Dravya Sevana, because of the Karma Sevana, what the Utpanna Vata is said, that will make the Jayati. It will make the Jaya of the Vata, Utpanna Vata. Because of the Guna which presents in the Taila, Sneha Guna, that is Nikta Guna, Aushna, Gaurava, that karma occurs because of the Guru, Ushna, Sneha Guna presents in the Taila. That not only in the one day, or the not the once if you use the Taila. It should be in a so the Abhyasyamanam Vata. In Vata, if you want to make the Utpanna Vata Jayati, or the Vata will make the Upashamana only by the Sadata Abhyasyamana of the Taila. Even Vata has the Ruksha Guna is there, and Rakshata is produced, Shita Guna is there, Shaitita will produce it, Laghu Guna is there, Laghavata is produced in the Sharira. Upapanno, these gunas present, Viruddha Guno Bhavati. Comparing the Taila, whichever the gunas present in the Taila, na, they are the Viparita Guna or Viruddha Guna, which are present in the Vata. Viparita Guna present in the Dosha, Viparita Guna Bhuista of the Taila always makes the Shamana. Upanno Viruddha Guno Bhavati, Viruddha Guna Sannipati. Sometimes it's a combinations also. Sneha, Ushna, Guru, or maybe in a particular Ushnata, which makes the Dravya as a dominancy. Sometimes Ushnata, sometimes Gurata, which presents in the Dravya. That particular Bhuya Yukta, Sannipata Yukta, sometimes combinations, they makes the Vatam Jayati with the Bhuyasa, or sometimes Alpa Avajiyate. Bhuyasa means Sneha Guna, Ushna Guna, Guru Guna combination is more. Alpa Avajiyate, sometimes it makes the, because of the Snehatva is only dominancy, remaining gunas are less dominancy, then it makes the Alpa Avajiyate. Tasma Tailam Vatam Jayati, Satata Abhyasyamana. Because of the Bhuyasa Guna, Alpavaji. Bhuyasa, if it's there, means definitely will make the Vata Jayati. Alpavajiyate means because of the gunas which are present in the less gunas. Comparing to the Rauksha, Shita, Lagu, they are the less guna yukta in the Dravya. That's why it's make the Alpavajiyate. So that's why Tasma Tailam Vatam Jayati Sadata Abhyasamana. Not only in one day if you are used it, so one time if you are used means it won't make the Jayati of Vata. It will make the Jaya anyhow. But if you are making the same tattva, same abhyasa of the Aushada Sevana or Dravya Sevana or the Rasa Sevana or Gunayukta Dravya Sevana, Sadata Abhyasamana only make the Vata Jaya. So this is a needed one. When you are advising to the patients, don't tell that patients should take only once. It should be practiced. After the Abhyasa only, the Roga Yukta, Gunayukta Rogas will get the subsidation. Like a Bhuyasa Guna is there, definitely will make the Vatam Jayati. Sadata Abhyasamana. Taking a small example like in a Nitya Abhyangam Achareta. Taking one day Abhyanga is not enough to reduce the Vata presence in the Sharira. Or maybe in the Pakshagata, if you took one day of the Abhyanga, it won't reduce the Vata. Maybe it's reducing, or definitely reducing, not maybe, definitely reducing the Vata. How much of the Vata is reduced in the one day Abhyanga? It is not able to complete the what the Pakshagata occurs because of the Vata Ruti occurs in the Sharira. To make the complete Vata Shamana means it should be make the Abhyasa Krama should occurs in the Sharira. One of the example I took the Abhyangal. Similarly, like some of the Lepas will be there. Some of the Ahara Drapyas will be the Guru Ahara Satra Sevana will be there. Like in the Grishma Rutu, they told it's a Madhura Ahara Sevana should be there. All the Grishma Rutu is because the Rukshata will be there, Ushtata will be there, Alpa Bala is there. Hence, Vata is getting the Sanchaya Avastha. Even in the Varsha also, they told it's a Madhura Abhyasa Sevana. Madhura Rasa Yukta Dravya Abhyasa. That Abhyasa is needed. Come to the Sarpi Dravya. Rasa Dravya Dosha Roga Prabhavata in the Sarpi. Khalvevam Eva Pittam Jayati. So anyhow, definitely the Sarpi will make the Pitta Jayati. or pitta shamayati. Madhurya shaityan mandatvacha pittam hi amadhuram ushnam tikshnam cha. Like Sarpi is having the Madhura Gunayukta, Shaitya Gunayukta, Manda Guna is there. Because of three these guna, which are opponent or Viruddha Guna, which are present in the Pitta. Like a Pitta is a Madhura. Pitta is a thick actually. It's a Madhura Gunayukta. It is a Ushna Gunayukta. It's a Tikshna Gunayukta. Opposite to these three, na? Hence that's why the Sarpi always make the Pittam Jayati. Similarly, as I told in the Tailana, Satata Abhyasamana only, that should occur here also. Come to the next third dravya, which is Madhu. The Shleshmanam Chayati, the Madhu. Because of the presence of the Rauksha, Taikshna, Kashayatvacha in the Madhu. Madhu is having the Ruksha Guna, Tikshna Guna, and Kashaya Rasa is there. Hence, the Shleshma is also have the Snigdha, Manda, Madhurashcha Guna. Madhura Rasa is there, Snigdha, Manda, Gunas are there. The opposite to the Ruksha, Snigdha Guna is there. The Tikshna Guna is there, it's a Manda Guna is there. Kashaya Rasa is there, hence it's a Madhura Rasa is there. The Shleshma, whichever the Rasa, whichever the Gunas are there, they are the Viruddha Guna present in the Madhu, hence Madhu is makes the Shleshmanam Jayati. Yachanyadapi Kinchit Dravyam Eva Vatapitta Kafebhyo Gunato Viparitam Sat Tat Cha Etan Jayati Abhyasamana. Not only these three dravya, like Taila, Sarpi, and Madhu, apart from these one, whichever dravya we are using regularly or maybe not advising to the patients, or patient may be practicing regularly, either maybe external, maybe internal, especially internal things only. According to those dravya, whichever the rasa pradhanata is there, according to that one, vata, pitta, kapha, according to those gunas, and viprita guna, either it may be na janayati or maybe na it's a shamayanti. Based on the either they're making the abhyasa, viprita gunayukta, or abhyasa of the samana gunayukta. When you come to the clinical applications, like Dravya Prabhava, how can you use it? As told in the Rasavimana. As they told, na Vata Pitta Kafebhyo Gunato Viparitam Sat Etat Tan Jayatya Abhyasamanam, they told. Na. During the Panchakarma, especially, like Shamanaushadhi, what we are using it. Na. Like external Chikitsa also we are using it. Some of the internal Aushadas are also using it. Like Abhyanga, Karnapurna, Seka, Padhabhyanga will be there, those are all one. Especially in the Pakshagata, Tailabhyanga, if it is makes the for the long period or Nityabhyasa or Abhyasa, Tatabhyasa, then Pakshagata will get reduced. Similarly, in the Amla Pitta, they told it's a Tikta Ahara Abhyasa. Tikta Rasa Bhuishta Ahara, if you are making the Abhyasa, definitely Amla Pitta will get reduced. It's Upashamayanti. So this is how can we utilize the Dravya and the Rasa in the Chikitsa of the particular diseases in the Vyati. Extend to the next one, comparing with those three, the Dravyani Nati Sivyani Trividam. Trivida Dravyani Nati Sivyani. Atha Kalu Trini Dravyani Nati Payunjita Adhikam Annebhyo Dravyebhya. Sadhyata, Pippali, Kshara, Lavanamiti. Why only these three as per the author? These are the three important ones. As per the geographical area, the people are consuming it. As we know, in the olden days, the people are having these only three dominated material to make the Venjaka of the Ahara. So enhance the taste in the Ahara. Based on that also, you can compare to the other things also. But particularly the Pippali, Kshara, Lavanas are having the regular usage is there in the particular area of the people and in the public also. Based on that, different qualities are present in that one. Based on the rasa, guna, and even the viryas also. That makes the things in the dosha prakopana or dosha shamana also. Like first one is the Pippali. Pippali has the Katuka rasa. That is a Madhur Vipaka Zate. Gurvena Atyartam Snigdoshna Prakledinyo. Guru Guna is there and Snigdha and Ushna is there. When it is used extra, then it's a Guruvena Atyartam Snigdoshna Prakledinyo. Athyabhyasa, when you do it, then definitely it produces the Guruta in the Sharira and even the Snigdhata in the Sharira also. So rasa and vipaka and guna, whichever it's present. Beshaja abhimatascha. So definitely after the long period of the doctor's observations in the patients, what the material they are used it. Like typically using peoples, they are observed it. Those people, those Beshaja, Bishak, they have made it a abhyasa present in their peoples. They observed it, then they documented one. Like abhyasaha anabhyasa yukta. If it they are abhyasa instantly, they are abhyasa for the long period. Two observation is there. One is abhyasa, sadata abhyasa, rati abhyasa, anabhyasa. The anabhyasa include either it's used its while or a temporary period. That sadhya abhyasa, if they are used instantly, they makes the shubha karma in the sharira. A small example, when the ajirna is there, if you took 1 day of the people means it will make the sadhya abhyasa. It is instantly it makes the ajirna hara, ajirna shamana. That is shubha karma. Adhi abhyasa when you do na, then definitely it makes the ashubhakarinyo bhavati. Ashubhakarinya means it makes the hazardness or maybe some dosha prakopa or other things will produce in the sharira. When you make the adhi abhyasa of this people. Why producing that one? Shubha. Apata padraha, when you used, when it is needed one at particular conditions, particular dosage, if you have used prayoga samasat punyat, according to the prayoga samaguna yukta, if you have used it, definitely make the shubha karma, shubhotpatti in the sharira. When you are not observing these one, if you have made the ati abhyasa, satata sevana, then definitely it make the ashubha karma, like dosh sanchaya anubandaha. Sanchita dosha anubandha will occur in the sharira. Satatam upayujyamanahi. When the person is used satata upayujyamana of the people, definitely those sanchaya anubandha will occur in the sharira. Why it is occurs? Because it's have the guru prakleditvat shleshmanam upakleshayanti. As the gunas it contains in the people, when you use the satata abhyasa, ati abhyasa, guru prakleditvat. Guru gunayukta, prakledi gunayukta. Because of that, it makes the shleshmana upakleshayanti. More shleshma will make the kleshayukta, upakleshayanti. Aushnyat pitta. It have an ushna gunayukta, the hence it makes the pitta prakopa. Nacha vata prashamanaya upakalpante alpa snehoshna bhavat. See, as a pitta has a ushna, but the ushnata present in the pitta, na, it is unable to do the vata prashamana. Nacha vata prashamanaya upakalpante. Because it's alpa sneha and alpa ushna bhavat. What the people have the ushnata, what the people have the snigdhata, it is less. Alpa bhava is there. Hence, it's unable to do the vata prashamana. It definitely make the vata prashamana not up to the requirement. Then it makes the na vata shamanayati, pittam prakopayati, aushnyat pittam, guru prakleditva shlesham upakleshayanti. Because of these three doshas are getting the prakopana. Prakopana in the sense variations. No, not to the normal conditions. So that's why it is unable to advise regularly. Yoga vahini tu khalu bhavanti tasma tippalihi na atipayunjita. Because of these reasons, never advise the pippali regular consumption. Make in the interval or within a small period, only can advise the pippali has to take for the patients in the particular conditions. And even it has an yoga vahini also. Continuously if you took means you, because the yoga vahini guna, guru ati utpatti is vakas in the sharira, it will make the shleshma utpatti in the sharira, it leads to the other diseases also. And even the aushnyat will produce in the sharira, because of the yoga vahini guna, other material or other dravya, if you are consuming ahara also, even the aushida also, it also increases the aushnya guna present in that particular dravya of the aushida or even ahara also. Next one is the kshara. Kshara is one of the rasa also, one of the dravya also. As per the charaka, it's one of the dravyas, not considering the rasa. Ksharaha punaha aukshna taikshna laghava upannaha kledayati ato paschat vishoshayati. So this is a particular quality present in the kshara. Like generally it contains the ushna guna, tikshna guna and laghu guna. It is utpannaha, upapannaha. It contains, and also when it used it in the sharira also, ushnata will produce, tikshnata will produce, lagutha will also produce in the sharira. Kledayatyado paschat vishoshayati. So first what will make the ado kledayati in the sharira? When ksharaha upayujyamanaha ado kledayati in the sharira, paschat vishoshayati. Later it will make the vishoshana in the sharira. First produces the kleda, then it will make the shoshana. The best example is the during the rainy season, the mud will get the clay. When moist is added to the mud, it will become the clay. The same clay, when it comes in the winter season, in the winter season, there is a moisture is there, but still it will make the, even though there is a clay, there is the shoshayati. This is in the Ksharagun. How the occurs in I took in a small example, how the, even there is a clay, there is there, upashoshayati is there. That's it. Here also in the Sharira, Kledata first it produces. When you consume the Kshara, first it produces the Kleda. Later it will make the Vishoshana in the Sharira. Best example, when I use the some detergent, etc. Starting it will produce the Kledotpatti. If you're keeping as it is, it will make the Shoshana. It's will getting the dry. That is called as a Vishoshayati. Shara, when it is used externally or internally, first it Ado Kledayati, then it makes the Paschat Vishoshayati. So anyhow definitely will make the Kleda, then it's a Vishoshana. Sa Pachana Dahana Bhedanartham Upayujyate. So definitely we are using the Kshara for the Pachanartha, or maybe na Pachanartha, Dahanartha, and Bhedanartha also. These are the three Upayoga from the Kshara. But it instantly, if you are using it, it will make the Pachana, it will make the Dahana, it will make the Bhedana. Ati Prayujyamana, it leads to the Vishoshana also will occur. So Ati Prayujyamanaha Kesha Akshi Hridaya Pumsopaghatakaraha Sampatyate. When you use the Ati Prayojana of the Kshara, if you are advised the Kshara to the patient, definitely the Kesha Upaghatakara, Akshi Upaghatakara, Hridaya Upaghatakara, Pumsopaghatakara will occur in the Sharira. One of the best example in the renal calculi, in Ashmari we are using the Kshara. Even in the Udara Roga also we are using the Kshara. Some of the Arbudha conditions also we are using the Kshara. If it is continued for the longer durations, definitely patients will making the suffering from the Kesha, Akshi, Hridaya, Pumsopaghatakaraha. One of my practice, the patient came with the history of he have the renal calculi in the past history. He took a long period of the Kshara medications. Because of that one, he is have the Pumsopaghatakara. Since from the 6 months, he is not have the Kesha Upaghata is occurs, and even eyesight is also reduced one. He have with the palpitations also. Raised heart rate is there in the patient condition when you are observed. So these are the one of the example when we are used the Kshara in the continuously. So that's why intermediately we have to change the medications to reduce or to nullify the effect of the long durations of the Kshara Upayoga Janya gunas or the karmas, the Sharira. Yehi enam grama nagara nigama janapadaha satatam upayujyate ta andya shandya khalitya palitya bhajo hridaya apakartinascha bhavanti taditha prascha chinascha. So as we know, in the Grama also they are using the Kshara, in the Nagara also, in the Nigama and the Janapada also, Satatam Upayujyate. Generally, they are continuously they are using that one. That's why the people are getting the Andhya, Shandya, Khalitya, Palitya. They will be occurs in their physical conditions or in the health conditions also. And even the Hridaya Apakartinascha. There is a pain is there, Hridaya Apakartini. Cutting like pain or the Apakartini Shula will produce in the Hridaya. Like in the people present in the Pascha and even the China. In the Western country also, even in the China Desha also, they have this Kshara consumption long period and that more conditions. So they are always have the conditions like a Andhyatva, Shandyatva, Khalitya, when the Palitya, Hridayapakartinascha. So that's why Tasma Ksharamna to be especially when we are observing the patients and just ask the history whether they have any of the kshara intaking regularly in any variety of the food, just avoid those. Some of the time, then the disease will not have a bigger issue. Just avoiding the nidana itself will make the good improvement in the health conditions of the patients, in the condition of the disease also. So that's why we have to make the observations whether the patient is having the consumption of the pipali or in the kshara also. Even sometime in the Udara Shula also, we are using the Shankavati in the longer period. Because of the usage of the Shankavati continuously, it's now the contain the kshara. Even in the Shankavati, Mahashankavati, sometimes direct ksharas will be using as a Yavakshara, Subject Kshara, etc. Either externally or internally. Most of the time, internally, we are using regularly. At that time, patients may occur with these symptoms also, or maybe the disease also, Andetva, Shandetva, and Khalitya and Palitya, Hridayapakathini also. Just observe it. If it is there, it is produced, means it is just to stop the kshara intake in the patients. As I told in the Ashmarihara Aushadhi, almost all have contained the kshara. The long period after taking of the medications for the Ashmarihara Chikitsana, the patients will end up with sometime these conditions also. Next one, Dravya is a Lavanam. The Lavanam Punaha Aushnataikshna Upapannam Anati Guruhu Anati Snigtam Upakleti Visramsanam Asamat Visramsanam Samartham Annadravya Ruchikaram Apatapatram Prayoga Savasatpunyat Dosh Sanchayanubandam Tadrochana Pachana Upakledana Visramsanartham Upayuchate. So Lavana will be used Tad Atyartha Upayujyamanaha. Sorry for the next one. So Lavana contains the Aushna Taikshna guna is there. Not having the Ati Guru Yukta, na Ati Snigdha Yukta. It has a Snigdha, Isha Snigdha. Nati Guru means Ishat Guru is there. Upakledi. It's also produced the Upakledi. Kleda guna is more. Upakledi. Visramsana guna is also there. Annadravya Ruchikara guna is also there. When it used generally, Rochanartha, Pachanartha, Kledana, Visramsanartha, we are using it regularly with help of the Lavana. Wherever we need the Rochana, Annadravya Rochanartha, Ruchutpatti in the Aruchi conditions, and even for the Pachanartha also Klednartha and Visramsana. When you use Atyartha, in the short period, if you are using, those are the important things you can able to make the karmas in the patient's conditions, in the diseases. Tad atyartham upayujyamana, when you used extra in the sense not the medicine extra, more than the required period of the treatment, then Glani will produce, the Shaitilya will produce, and Daurbalya also produces. Glani, especially in the Indriya Glani, even though they are not doing any of the work, the patients will have the tiredness feeling will be there. Shitilata of the Shariras will be either maybe Namams Shitila Asti, Shitilata, Shira, Shitilata, etc. Durbalata will be the Sharira Durbalata. Abhinivrutti Karam Sharirasya Bhavati. So definitely patient will suffering from these ones if you are used the continuous time. One point is that regularly we are using the Lavana as a Annadravya Ruchikara. Even today also all the people are using the Lavana as a part of the adding in the Ahara Dravya preparations, in the Pakvana, Kritana also. But still, if it used Atyartha Upayujyamana, more than the requirement, more than the Anna Ruchikara, more than that, if you are using, then definitely patient will suffering from the Glani, Shaitilya, and Daurbalya. Yehi Nagara Grama, Nigama, Janapadaha, Sratam Upayujyate. Definitely, this is also same like in the Kshara. All the variety of the peoples are usage. They're doing it. They're taking it internally with their food preparations. They Bhuistam glass navaha. Those people are having the glass navaha. Shitila mamsa shonitaha. Apariklesha sahascha bhavati. How can you observe the patients is consuming the more lavana? Just observe the patients whether the patients have the glass navaha, glani yukta, or shitila mamsa shonitaha, or apariklesha sahaha, is not having the klesha saha yukta. Sometimes he's not having the good quantity of the mamsa and the shonita in the sharira, like the shitila mamsa, shitila shonita is there. Or small, because of doing a small work also the patient is having the glani yukta means, then definitely he is having the tendency or practicing of the lavana ati upayujita, sadata upayujita. That this is one of the best observations. You can avoid this one simple one, definitely patients will get the improvement in the particular diseases also.
Sir, you can finish in next 5 minutes.
Yeah, yes, madam. Yes. Similarly, in the Lavana also, they told it's a Payasa, Pisaha, Lavanam Ashniyat in the Saurashtrika, Balika, etc. Then Saindava Pradeshas also. Definitely, those patients, those areas, the people are having the Glani Yukta, Shitila Mamsa, Shodita Yukta, and even they are having the Kleda Yukta also. The Lavana Atipayunjita is occurs Khalitya Phalitya Valayascha Khale Bhavati. Akale, before to the requirement of the time, the patient will suffer with the Khalitya and Phalitya, and even the Valayas also produces. That's why patient can observe these symptoms also, sign and symptoms, can take as a patient is having the tendency or practicing of the Lavana intaking more than the recruitment for the longer period. They have the habit. The word I told the Khalitya, Palitya, Valaya, they are the Roga. Klasnama, Shitila, Vamsa, Shonita, Aparikleshis, Hasha, these are the Lakshana. How can you identify the patients are taking the Lavana means? These are the Lakshana. And these are the Rogas will be there. Whenever the Rogas comes with these particularly, just to check once the patients in whether they're having the habit of the Lavana intaking in the more. Next to the Satmya Avastha. Satmya, as we know, the Satata Abhyasamana, which is not making any of the dosha prakopa in the Sharira and not producing any of the diseases. That is called a Satmana Sharira. Pramena Apagamanam Shreya. When having the patient is having the Kshara Atisevana, Lavana Atisevana, Pippal Atisevana, definitely it should be reduced that practice Pramena Apagamanam Shreya. Otherwise, whatever the Satma he took, either it producing the dosha in the extra quantity or in the Alpa Doshakara Bhavati in that particular patient. Now to the Satma Anupashete. Upashete, especially when the patients are taking some of the ahara, vihara, or dravyaja, or rasasra, if it is making the upashamana in that particular sharira, definitely called as a satmyukta. That's why the satmyartho hi upashayartho. Upashaya, wherever it occurs, that itself is called as satmyukta. So satmya usually trivida and saptavijata are there. Whichever things we are making the satmya, that satmya will always makes us to get the upashamana from the doshas or in the rogas also. As one of the examples, Sarvarasa Satmya is the Pravara Satmya, for particularly when you are consuming the ahara regularly for the Sharira Poshanartha. There is a Prakriti itself. Whichever the Pravara Satmya we are made for the Sarvara Sabhyasa as according to our Prakriti, that is the Tukta Prakrityadi Upayot Krashtamanani. Like similarly, when we are taking the rasas, as according to our dosha pradhanata in the Sharira, that will make the help the upashamana of the Sharira Yukta dosha. If Vata Prakriti is the Snigdahara, if you are consuming, that is makes the Satmya for us. So that's why the Ahara is the main prime important for the Sharira Poshanartha. So that's why there is a Ashtav Ahara Ayatanani is there, in which way we have to take the Ahara. They are the Prakriti, Karana, Sanyoga, Rashi, Desha, Kala, Upayoga, Samstha, Upayokta is there. Like Prakriti is nothing but its own Swabhava, like either maybe contains the Gurvadipna Yukta, Arnina, Rasayukta, etc. Karana, as you know, it's a Samskar itself, it makes the Guna Adana. Sanyoga is nothing but a Dravya Sanyoga only, like a Madhu, Sarpi, Madhu, Matsya Sanyoga, etc. They comes under the Sanyoga only. Usually, because the Sanyoga of the Madhura, Kshira and Madhu. Sometimes Sharkara and Kshira, those also comes. Viruddha Sanyoga is also there, Sama Sanyoga is there. Rashi is nothing but it's Matra, Matra Phalayukta. Desha is nothing but the Sthana, from which Sthana it is taking and where we are taking it. Kala is nothing but the Nityaka, Avastika is there. Avastika for the Vyadi, Nityaka is for the regularly what the time is there, Samvatsara, Rutu, Vibhaga, Ahoratra, etc. comes in. Upayoga Sanstha is nothing but the niyamas are there for the consumption of the ahara, that is called as Upayoga Sanstha, Upayoga Niyamahas. Especially it's observed based on the gene Lakshana Apeksha. Upayokta is nothing but the Satmya Yukta. Whichever Satmya for me, na, like Ishta Ahara, this is the best for me, this is the best of the Ahara. Punaha Tasmat Ahara Upayukte, Yad Adatte Okasatma, especially for the Okasatma. This is the best one, even though I don't like this one, but it's the best thing. Make it Satmata, that's Okasatma, Satatte. That is comes to Upayokta. Not only the Ashta Ahara, the Prakriti Karana Sanyoga Rashi Desha Kala Upayoga Samstha Upayokta, Ahara, rasa, dhatus are involved. This is done especially for the chikitsa. When you're observing the patients, you make the helpful for the ahara, which ahara is there, which rasa is there, which dhatus is getting the improvement in the sharira. It is based on the these only. If the ahara prakriti itself is in madhura means, so definitely it madhura rasa makes the rasa dhatu utpatti in the sharira. Like we have to make the chikitsa adaptations with the patients, involvement and adaptations of the these ashta ahara itrani in particularly in the patients only for the ahara consumptions. Even not only for the ahara, it is also helpful for the nidana rupa samprapti roga chikitsa. There in samprapti vigatan also it will make the helpful also. Even it also include the bhoja sadh punyasa. like उष्ण स्निग्ध मात्रावत जीर्णे वीरि विरुद्धम इष्ट देशे इष्ट सर्वोपकरणम नातित्वम नाति विलंबितम अजल्पम अहसन तन्मना भुंजित आत्मनाम अभिसमीक्ष. So these are the told as a bhoja sadhunya. These are the guna should be used when you are taking the bhojana. Directly I'm moving the what the importance is there for the taking of the ahara. These bhoja sadhunyas are there. Ashta ahara vidvishesha is there. And one of the best quotation is given by the Yogindranath Singh in the Charkupastara, like Sa Vishak Sa Eva Vastuto Vaityaha only. Like whoever the doctor is there, rasan dravyadi doshanscha vikarascha pravartaha vedaha, who know about the rasa, dravya, dosha and vikara, prabhavata he know, and definitely with the desh and kalo for the sharira, about the sharira, definitely he is the best doctor. Sa no bishagiti na asmakam sammata ityartha. If he don't know about this one, definitely we are not calling as him as a doctor. If we want to make as a mention, he is in a bishak means definitely he should make the understanding of the rasa, dravya, dosha, and vikara and prabhava. And even the desha and kala also should be known. That is Veda Vidya. Because ahara only sharira utpatti is occurs, that's why the bhojya sadguna is needed one. Astavida ahara visheshayatana is also needed one. This is an upasamhara. My conclusion is the Hetulinga Aushadha is Dana is there in the Charakasana Samhita. So all the Vimanartha, Rasa, Dravya, Dosha, Prabhava, Zate, Dravyani, Nath, Sevyani is there, Satmya, Ahara, Ashta, Vida, Ayatanani is there, Bhoja, Satpunya, Zate. All are related to the Hetulinga Aushadha only. Like Aptopadesha, Pratyaksha, Anumana, these are needed. Na? Similarly, Chikitsa Siddhi will occur. Similarly, when the doctor is understanding the Rasa, Dravya, Dosha, Roga, Prabhava, Satmya, Ahara, with the Ashtayatanani, Bhoja Satpunya, definitely Chikitsa will get to Siddhi. This is an intention. So when you understand the better way of the Yasemana, how much of capacity I have can understand the Vimanasthana of the especially Rasavimana, I can able to do the Chikitsa in the Siddhi Avastha. Either maybe in a less Siddhi, complete Siddhi, more Siddhi. Depending on the disease condition, depending on the Arthas, what I understand about from the Rasavimana. I make an acknowledgement. It's whatever I told the good things. It is from my guru, Dr. Srinivas Wadiyar sir. And I also thankful for the Dr. Anand Katti sir. He is forceful guided for me. And I also thank for the Vishwa Ayurveda Parishad and the Wikipedia websites I used for the preparing this one website, this one PPT. And I used the help of the Samhita collections and some of the Google images. Thank you.
Thank you so much, Dr. G. N. Kannoli, sir, for the insightful and knowledgeable. Anybody who has any doubts can post their doubts in the chat box, or else you can raise your hands and we shall unmute you and you can ask your doubts.
If any participants have any questions, they can raise their hand clicking on the reaction icon or ask a question in the chat box.
In case the participants don't have any doubts, we can move further to the vote of thanks.
Yes. No,
I
there
would
are,
request,
wait a minute. There are some hands. Raghavendra Rao Shivpura. I am unmuting. Sir, you can ask the question.
Thank you, sir. Nice presentation.
Yeah, thank you, sir.
I'm having doubt in Lavanarasa,
Yes,
and that you told Apatabhadram Samasad Gunyat. What exactly it means?
Apadabhadra Samasat Gunyat means as per our requirement for the Sharira in the Ahara, whatever the guna we are needed, na, according to that one, if you are used instantly, that thing is called as a Shubha Karma Yukta. Small example,
What
sir.
does it mean? Apatabhadram means what?
Apadabhadra means not in the Vishima Avastha, in the Mithya Upayoga, it's a Sama Upayoga, sir. Even you can call it a Samyak Upayoga. Is it clear, sir?
Not clear, sir.
So,
Because
in simple word, it's in a Samyak Upayoga, sir. Apatabhadra. Word meaning is an Apatabhadra means Sampurna means.
pardon, sir?
Word meaning is there Apatabhadra means a complete word. But as per our equipment, what the guna is needed, na, if you are used in a Samyak Yoga, na, that is called Apatabhadra Savasat Punya. In simple Sama Yoga. Or in the Samyak Upayujyamana.
Okay.
Okay. Next is Anupama Hukkeri. Anupama, you can unmute and ask.
Hello. Namaste, sir.
Namaste, madam.
Ask.
Wonderful presentation, sir. Sir,
Thank
I
you.
wanted to ask about Saindava Lavana.
Yes, madam.
Saindava Lavana, it is good for hypertension, like that it is in practice also.
Yes, madam.
Most of the hypertensive patients, they are taking, in routine food also, they are using that Saindava Lavana.
Yes, madam.
Is that a continuous use of Saindava Lavana may cause any complications or side effects?
No, madam. As it is in a Nitya Upayogi Dravya, Nitya Sevaniya Dravya Saindava, hence never it makes any of the hazards in the Sharira. It will make the enhancement of the Swasthya Palana or a Swasthya Anuvartana in the Sharira itself when you are used regularly.
Okay, sir.
As the other Lavanas have the Ushna, but the Saindava is not have the Ushna Guna Yukta. But Ishat Guna is there, Ushnata, the Anushna it is. It is not have the Ushna, it's Anushna Guna Yukta.
Nati Ushna, like that it is mentioned.
Yes, madam.
Sir, what about the other Lavanas, sir? Audbida Lavana, it is like muddy. Whether in the recipe, muddy part should be separated.
Madam, some
Audbida
of
Lavana, it is almost like mud. Appearance
mud
is mud mixed with the salt. Like that it appears.
yes, madam.
Whether using in the Rasa Yogas, like Panchalavana, if it is there, the combination, whether to go for shodhana of that Udbida Lavana to separate that muddy part, or along with the muddy part only it is being useful?
No, madam. Sometimes samskara is needed for an upyoga. Some of the preparations are there while if you are using in the that combinations, na, as it is, it's okay. Some of the preparation itself is there, samskara yukta, like a dauta, chalana yukta, etc. If you're using the combination of the other lavana or maybe in the preparation of the dravyas, then it's okay. But alone, if you're using means it's need a palatable form for the patients.
Okay, sir. Thank you.
As we are collecting the saindava, sometimes it's mixed with the mud also. We're separating that one for the purpose of the usage. If you are used in the ahara means, it's detaching the remaining things whichever the not needed particles from that particular drug. Na? They're separating itself in the preparation of the ahara itself. That is the process. Ahara, Kritana Vargas also there, in the Bhavnas also there. And sometimes the preparation of the Tailas also there. Like a Patu Taila is there in the. There we are preparing the Patu, it's a Lavana itself, as a preparing the line itself. It extracting the things which are present from the Lavana itself.
Okay, sir.
Okay, madam. Thank you.
Thank you, sir. Thank you.
Okay, there are no more hand raises. Oh, Dr. Samhita Basapur. Dr. Samhita has a question. You can unmute and ask.
Good evening, sir. Very wonderful presentation. Nice presentation, sir. I just wanted to ask one question, sir. Like this Kshara Lavan and Pipali, it is Nitya Sevaniya Dravyas. Whether these can be given in children's also, sir, or no?
Pipali, Kshara and Lavana, they are not Nityopayogi Dravyas, madam. As according to needed, na, you can use for those three dravyas for the even in the children's also. But only for the Shubha Karma, if your need means, according to that particular period only you can use it. Like Ajina is there. Up to the Ajina Haravastha, you can use the Pipali, Kshara, Lavana. Not more than that exceeding the after the Shamana also, you should not use the same dravya for continuations in the patients.
Okay, sir. Thank you, sir. And nowadays, these like, pediatricians, they strictly say Lavana should not be given to kids up to 1 year. So what is your opinion regarding that, sir?
Samudra Lavana is not indicated to give for the 1 year children up to the 1 year. Saindava can be adoptable, madam.
Okay, sir. Thank you, sir.
Thank you, madam.
Okay, Isha.
Now we move forward to the vote of thanks. I would request Dr. Arvind Kumar Gupta from Government Ayurvedic Medical College, Pilibhit, Uttar Pradesh, to convey the vote of thanks. Over to you, sir.
Thank you, ma'am. I'm audible. Am I audible, ma'am?
Yes, sir.
Yes,
You
sir.
are
Yes, sir.
audible.
हाँ
Yes, sir.
सर वोट ऑफ थैंक्स सबसे पहले तो मैं विश्व आरोग्य परिषद के जो हमारे गुरुजन हैं, जो संरक्षक सचिव और हमारे जो संहिता परिषद है उसके अध्यक्ष प्रोफेसर इलकल कुमार मिश्रा सर, अन्य हमारे संहिता परिषद के कन्वीनर्स आनंद कट्टी सर, देवेंद्र सिंह चाहर सर और जो हमारे रीजन वाइज कोऑर्डिनेटर्स हैं, जो इस प्रोग्राम को ऑर्गेनाइज कराने में हमारी सदैव हेल्प करते हैं, उन सभी जोनल कोऑर्डिनेटर्स का भी धन्यवाद करता हूं कि उन्होंने इस कार्यक्रम में प्रत्यक्ष या परोक्ष रूप से हिस्सा लिया। इसके बाद मैं धन्यवाद करता हूं उन सभी ऑडियंस का जिन्होंने इस कार्यक्रम को ध्यान से सुना, क्योंकि बहुत सारी बातें हमें वहीं से पता चलती हैं। और सबसे बड़ा थैंक्स डॉक्टर कन्नौली जी का, जिन्होंने अपने जो गुरुजनों द्वारा सिखाया गया ज्ञान है उसको बहुत अच्छे से हम लोगों को समझाया और हमारे ज्ञान में कुछ अंश में जरूर अभिवृद्धि की। एक पॉइंट मैं इसमें जोड़ना चाहूँगा अपनी तरफ से कि जैसे सर ने जो प्रेजेंटेशन दिया बहुत ही अच्छा प्रेजेंटेशन था। और प्रेजेंटेशन में कई एक या दो तीन स्लाइडों में ऐसा है कि ग्राम, नगर, निगम और जनपद, ये चार आज भी हमारे जो राज्य हैं उनके निकाय या बनाने के लिए, स्थापित करने के लिए यही चार एंटिटीज हैं और वो बहुत पहले से हमारी संहिताओं में लिखी हुई हैं। इसको सर ने भी और सभी चीज़ों को जो इस चैप्टर में रस विमान अध्याय में बताई गई हैं उन सभी को सर ने बहुत अच्छे से हम सभी को समझाया। इसके लिए और हमको दोबारा से ये सब चीज़ें रिवाइज करने का मौका मिला और एक दो पॉइंट नए भी मिले मुझे। इसी के लिए मैं कन्नौली जी को फिर से धन्यवाद देता हूँ और मैं सभी मेंबरान का भी धन्यवाद देता हूँ जिन्होंने इस कार्यक्रम को आयोजित करने में सहयोग दिया। और अंत में सभी का धन्यवाद धन्यवाद धन्यवाद। ओवर टू यू मैम। मैम।
Meanwhile, there is a question by Dr. Anishetti Sridhar. Sridhar sir, quickly unmute and ask.
Sir, sorry. Namaskar, everybody. It was a very good presentation, sir. Kannoli sir. Simple and sweet, very sweet. Yeah. Actually, I joined little late. Anand Katti sir has shared the link, but I was in some other meeting. So, sir, regarding this Viruddha Ahara, like we have been telling the students all the time, whatever the textbook references are, classical reference, Matsya, Dugdha, and other things. And there are two aspects of this. If you can throw light on this, like Viruddha generally by some my acharyas told that it is only for two things. Like if there are only two individual things like Matsya and Dugdha, it is applicable. If it is three, Matsya, like Dugdha and some other thing, third one or fourth one, so it is not applicable. So it should be clear to all the students. That is one.
Yes.
So if you can share your experience about this and what are the new Viruddhahara like you have otherwise for your institution or you have prepared, so that if you can share to Anand Katti sir the new items, food items or whatever is there, so we can also share to all the students across the India from our Vishwa Ayurveda Parishad. Thank you very much, sir.
Yes, sir. Thank you for the good research-provoking questions, sir. It is. As you told, equal quantity of the madhu and the sarpi is in a viruddha. Sometimes it's a rasa viruddha or viri viruddha. Especially we are talking about the viri viruddha. Sometimes it's a vipaka viruddha is there. Guna viruddha is also there. Depending on those things, when you are adding more than the other things, effect will make the nullifying, but totally the effect is not going on. One of the best example I will take it. Normally we know the Surana Kanda.
Yes, sir.
Yeah, Surana Kanda. Normally when you are used as a raw, if you are eaten that, it will make the Kandu Utpatti in the Sharira.
Correct.
Yeah. Instead of that one, using raw, if you are made the samskarana, taila bharjana or grita bharjana, definitely will make the nullifying that effect. It's a dravya viruddha if you are taking it. Similarly, some of the things are there, as you told, the matsya is there and the dadi is there. If you are adding other things, definitely it will nullify the viruddha gunotpatti which occurs because of the dadi and matsya or kshira or matsya when it combined it, but not totally, sir. The remaining thing will be there, but effect will be less one. It won't go completely. It will be there, sir. Regarding
Yes.
of other than these classical examples, some other things are also have the practice in the rural area. When some of the doctors are also observing the some of the things are getting the viruddha for some particular persons also. It's depending on their own satma, our own desha also, their sharir prakriti also. So that has to be get researched it till it's needed some research, sir, to make the valid statement for to make the this is a viruddha according to their prakriti, according to their desha, and this is a viruddha ahara which are present till now for the practice of the peoples also.
Yes, sir. Thank you, sir.
Thank you,
Because
sir.
people are using pizzas and milkshakes and everything. So we tell milkshake is okay. Okay. But my students tell, sir, we are adding so many things, not one or two. We are adding 6 or 7 items. So there is no viruddha we are taking. We are good. So we can explain them. But I think if you
One
can
of the
explain
example I can
scientifically.
add, sir, for your
Yes.
answer, sir. One of my best patient, they having the skin disorder, sir. During after the completion of his all the symptoms reduced, now immediately he took the milkshake, sir. All the symptoms whichever arised in the past, now which are subside now, they got instantly provoking, sir.
True.
It seems that
Very
the effect of the things are there now when you are adding them. Samudaya prabhava is there, but still it will be there of the viruddha yukta, whichever you combined it. That will make the effect in the patients when it consumed or when it used it. It not meant that it will be nullifying it. If it is getting nullified means it should be with particular samskaras only. As I used one of the example which regularly using in the southern India's people, that is the vegetables.
Thank you, sir. Thank you, Anankali, sir. Thank you.
Yeah,
Thank you, sir.
Thank you. Vishen.
Thank you, everyone. It was an insightful session. Now, as we come towards the end, I would like to end the session with the Shanti Mantra. Sarve bhavantu sukhinah, sarve santu niramayah, sarve bhadrani pashyantu, ma kaschid dukho bhag bhavet. Om Shanti Shanti Shanti. Thank you.
Thank you. Thank you. Thank you, everyone.
Thank you, sir.